Dr. Fukushima, thank you for sitting down with me today. I would love to start with the story behind your new name.
So we were called Pono, which means to make well, and it lasted for 5 years, and I didn't renew it in time, and I lost the name. So I had to rename it, and it's now called Omana Brain Health and Wellness Spa.
Okay. What does omana mean?
Omana is Hawaiian for empowerment.
Oh, and why is that significant for your clinic?
I wanted to focus more on people being able to take control in their lives in a world where control is a lot of times taken away from us. So to empower them to be their own beings and to have some say in what happens to them in life.
Oh, okay. Along with the new name, I understand you've expanded your services. Could you tell me a little bit about what's now being offered that the patients didn't have access to before?
We still do the transcranial magnetic stimulation for depression and anxiety and OCD, but I've also purchased some machines that do functional wellness, so things that focus on incontinence and erectile dysfunction. That's one machine, and there's another one that's for a milder form of transcranial magnetic stimulation called the ExoMind. And there's a final machine I bought, which is an M-Sculpt, and that's to help with not just sculpting the body, but also regeneration of damaged muscles, nerves, ligaments, and tendons.
Okay. How did you get into that? I mean, isn't your background in psychiatry?
It is in psychiatry. So it's taking the technology of what we use with transcranial magnetic stimulation on the head and applying it to other parts of the body in kind of the most natural way you can think of without using medications. So I figured head to toe, hit it all.
Okay. For someone who's only ever experienced traditional psychiatry, what makes these treatments different?
They're getting at the source of the problem. Rather than taking a medication that's going to be systemic all through your body and have side effects, this hits the core of the problem. Just like TMS will hit the brain itself where you're depressed or anxious or having obsessive compulsive thoughts, this is going to hit the muscle that's damaged or the muscle that is underused or the pelvic floor that is not working right and causing incontinence.
I know you said something about magnets too. It sounds a little painful. What is that like having these treatments done?
It varies from person to person. We always try and make it tolerable and go very slow and start off small and work our way up, kind of like physical therapy. Some people like the treatments. They feel really good. You feel like you've got a good workout with some of the ones that are there to tone your muscles or to resculpt your muscles. We never try and make it where it's so unbearable that you never want to come back. We want you to work through things, just like a physical therapy session.
Okay. And I know you're moving locations to a new one. What can patients expect when they walk into that new space?
We have a little bit of a different layout because it's a different place. So instead of the more open concept, you're going to come into a waiting room with several treatment rooms. Each one will have different devices. We will also have kind of a bigger conference room, kind of call it like a mitigation room, to try and work out between families, couples, any kind of issues that need to be resolved before we start to get to a place of point of no return.
Okay. How did you design the space to kind of support healing, wellness, and that sense of relaxation?
We try and make it very welcoming. If anybody's ever come to the office here before we leave, you'd know that it's not a traditional doctor's office. I wanted it very comfortable where it looks more homey, like a house. The new one does have like a waiting room, but you're going to see very familiar faces. We're going to try and make it a nice, peaceful place, but still we cater to you and remember that you're a human being.
Speaking of traditional doctor's office, I know you're no longer accepting insurance as one of these bigger changes. What brought you to that decision?
Insurance makes things very difficult to get done. It's not about getting somebody well, it's what's accepted in their policies. When we don't take insurance, it opens up a lot of doorways and no limitations, because then I can offer things and the staff can offer things that a traditional insurance company wouldn't allow because it doesn't fit in their cookie cutter. Because they're about making the person to the best of their potential and not just what an insurance company tells us they can have.
Okay. Never think about it that way. But how does not working with insurance change the care experience for your patients?
They can have more autonomy. They can tell me what they would like. I can tell them what's safe and what is probably the best in terms of like my medical knowledge, and we work together on a plan without a middleman to put up roadblocks.
And so I guess with that, affordability is something that's important too. Without insurance, what options are available for patients who still want to access the services but at a manageable cost on them?
Yes, I mean, I realize it's Hawaii and it's hard for everybody. So I've got something called Care Credit, which is kind of a loan for medical procedures that we will help you get qualified for if you can. We will do something like payment plans to work with people. We're just trying to make it manageable, where we allow you to get the care and the treatments you want without the limitations of an insurance company saying no.
In your experience, these treatments that you're talking about, who can usually benefit the most from these treatments?
Pretty much anybody. I mean, if you're talking the traditional transcranial magnetic stimulation, those are people that have severe depression. If you're not dealing with insurance companies, we don't have to wait until you are severely depressed and suicidal. I would rather treat you earlier. There's the ExoMind, which is for people that have some mild symptoms of depression with sleep issues, concentration issues, appetite changes. And the other one's the EMSALA. That one is for incontinence, women who have trouble with holding their bladder, or they've had many children and they have some vaginal prolapse, or people with performance problems with sexual activity. And the M-Sculpt, which is for muscle sculpting or muscle regeneration, any athlete, anybody that's trying to stay physically active. Older people, they lose muscle mass a lot faster, and so we want to counter that to try and keep them mobile and active.
For someone who might be hesitant or unsure about trying something new, what do you say to help them ease their concerns?
All the treatments, I've done it myself. So I guinea pig myself to make sure it's something doable. A lot of them, almost all the staff has tried. My parents have been guinea pigs. So I wouldn't do it on myself or people that I care about if it was dangerous. These are treatments that are very safe, more so than any medication that you would probably take. So it's worth giving it a shot.
Well, could you share a success story or an example of how someone that you know or someone that you've treated's life has changed after receiving this kind of care?
Yes, the transcranial magnetic stimulation I've done on many people. One of the ones that comes to mind is a woman that I still see, and she has done tremendous with the mag ventral machine that we use. And she's done about 3 courses of it, and she has changed into a different person. She was pretty debilitated. She was having a lot of neuropathy and pain and depression. And after having the set of course of treatments, she would get so much better. And after a while, she would kind of decompensate a little bit. We give some more courses and she would do fine. Now what we're doing is more couples counseling and family therapy with her, because now that we've solved a lot of the current problems, which included being a chronic alcoholic, we're facing some of the issues from her childhood, because those are things we need to have resolved, and we can actually get to those now because we've taken off things that are like maladaptive coping skills, like sabotaging yourself or drinking alcohol.
I know the biggest thing that comes up with people that face depression or mental health issues is sometimes it's hard to get that person to feel comfortable enough to start treatment or to reach out on their own. What would you say for those people that are hesitant to even come in?
I would tell them everybody feels like how you do at some point. We all have our highs and lows, our worries, our traumas. Just come and talk to us. We don't judge you. We've all been through it ourselves. Some of us do these treatments and we believe in them. That's why we offer them. Before you do anything that you can't come back from, talk to us first. And we're not going to turn you away. We want to work with you. We want to make this so that you don't ever regret that decision to open up.
I hope that they hear that message, and I appreciate you taking time to talk with us today. Sounds like you're doing some really important work, and glad to be a part of it.
Thank you, Taylor.
Thank you.